Hi, my name's Penny Snowball. This is an extra that we've decided to put on the end of the series, documentary series In Search of My Mental Health and the Road to Recovery. We felt really that we would like to give people, now that we've given you the sort of the information that we've given you, we're fully aware that we've only really scratched the surface, but we wanted to start a debate really. We wanted to start opening up things for discussion, and there's a website, you can go to pennysnowball.com, and we can debate everything that you feel that you'd like to discuss. And feedback, we'd really welcome any feedback from what we're doing, and you can tell us what you'd actually like and what your thoughts and any experiences that you've had, and how you think the services have helped you, what you feel that they haven't helped you, and just bring everybody together to try and work forward to find a solution for what I consider and what we consider to be a major problem, which is why we're doing this documentary now. It's just like, what would you like to say, Sandra? Is there anything, what would you guys like to say to winding up?
What we've said is our opinions. Very respectful that some people might not agree with them, and if you don't agree, let us know, because that'll be interesting, and we're always interested to sort of hear other points of view.
Yeah, I agree with Sandra, and I think I'd like to emphasise that we are not trying to denigrate what's going on out there. I think the people out there, especially in the NHS and the other services, are struggling really hard to give the best they can to people under the circumstances and with the finances they've got. I think they're a brave bunch of people, and they work under a lot of stress and a lot of pressure to provide a service, and I admire them for that, and I think they're great. I think the problem is that because of that stress, it doesn't allow them enough time to really look at what's going on, because they're in constant pressure to work with people, and if they had time to stand back and review it in a way that was really positive, I think I'm certain things would change. But if the money was there, I think as addicts, we have a responsibility to start thinking about how we can help other people achieve, especially if we're in recovery, what we've achieved. Part of my when I was in AA, part of the 12-step program for me was to carry the message to other people, and I think doing that is about helping other people to achieve what they need to achieve, and it helps me in my process of recovery. So it's a two-way thing, really, and I think. I know, Penny, you're thinking of starting an agency called Addicts for Addicts, and I think this will be a great way forward, where actually people with the qualifications and who are addicts will be able to work with people who are just starting out on the road.
I think that's very cool, and I think basically if anybody watching this hasn't connected to either AA or NA or CODA or SLA or OA, all these organisations are out there. They are worldwide, and basically they are very, very helpful. They're not for everybody, because a lot of people find the God word a bit of a problem. They're not for everybody, but if people go online, then type in addiction help or whatever, you'll find something. I hope that you'll find something, and from this process that we're doing now, there'll be online discussions, and you'll be able to see other people's comments, and which will be on the blog, and you can always recontact them. I'm sure we'll open up a lot of debate, and hopefully anybody that is feeling lonely and struggling will be able to start voicing how they're feeling. I am setting, as Richard said, I am in the process of setting up with these guys a social enterprise entitled Addicts for Addicts, and we're really doing a lot of research and looking for funding and setting up. We're starting anyway, because people are generously offering their time. We're getting rooms people are offering, and we're going to start with groups for people. and then we'll be doing individual therapy, and we'll be expanding from there, and to meet the needs of people so that they're not, having to wait during these long waiting lists, and just try and filling in the gap. We're also going to be doing loads of fundraising and having fun doing it, I hope, involving people who are already, well in recovery, who are successful, to participate in raising money and helping other people who are struggling and who haven't actually got the money to actually get the help that they need. I'm still struggling. I wouldn't be able to have the therapy that I have if a friend of mine wasn't paying for it, and I'm eternally grateful to that, because I was very ill when I came out of rehab and I couldn't afford to get the help I needed. And that's where this is born out of, my need to get well, really, my desire to get well. And I just hope that it's helped. I hope it helps, and we'll look forward to hearing from you. Thanks very much for watching.